Ghana, and welcome to another episode of Fruits of the Womb. Thank you for making that healthy choice of joining us today for authentic information on pregnancy and child health. My name is Dr. Vera Bayu, and I'm your host. It's the expectation of most couples after marriage to have children. For many, this comes easily, but for a few, this can be very challenging. Today on Fruits of the Womb, we look at options in infertility when the babies won't come. We'll go on a quick break. When I come back, I'll introduce my guests. Stay tuned.
Your presence has changed my life. Your tenderness makes me want to take care of you forever. And I promise that I will give you nothing but the best always. Cousin's Baby with natural ingredients also gives the best care for baby's soft skin and hair. Cousin's Baby, growing together naturally. From your first shopping list to the very first sound you made, to your first bath, your first date. You've brought me so much joy, and I promise to always protect you. Camel Baby Antiseptic with a mild formula protects your baby's delicate skin from germs and bacteria.
So welcome back. This is Fruits of the Womb, brought to you by kind courtesy of Cousin's Baby and Camel Baby Antiseptic. Let's stay interactive. Join us on our Facebook page. Go to Facebook, type Fruits of the Womb, and you can post your questions, comments, and contributions. It may be about today's topic or any other health issue that you may have, and we'll do well to attend to them. Today on Fruits of the Womb, we discuss options in infertility when the babies won't come. To help us discuss this very important topic, on my extreme right is a familiar face, Dr. Titus Bayu. He's an obstetrician gynecologist with the Kolebu Teaching Hospital. You're welcome, Dr. Bayu.
Thank you very much.
And on my immediate right is Dr. James Wachi. He's also an obstetrician gynecologist at the Lekma Hospital. You're welcome, Dr. Wachi.
Thank you.
I'm always afraid to bite my tongue when I say obstetrician gynecologist.
So yes, OBGYN.
OBGYN, yes, maybe.
It's accepted.
It's accepted, yes.
Yes, so let me start from you, Dr. Bayu. We know how children are so important, especially in our society.
Yeah.
How do we define infertility in the first place?
So infertility is a very unfortunate diagnosis to make most of the time because of the pressure, especially in our environment, because of the pressure associated with having to have children soon after marriage. Sometimes even a week, people are coming to see whether you are vomiting.
Whether you are vomiting.
or something like that, yes. But from our point of view, we say that a couple has challenge with fertility or infertility if they have had regular unprotected sexual intercourse for at least a year and the pregnancy is not coming.
Briefly, what are the causes of infertility, especially commonly in our environment?
I mean, this is a very good question. And I must say at this juncture that you have both male infertility and female infertility. It's very important.
So it's not a female problem?
No. Because in our environment, when we say a couple is infertile,
then it's the woman.
Yeah.
But the percentages are 40, 40, 20. 40 from the woman, 40 from the man, and then 20 combined and other things.
So it's evenly split.
It's evenly split.
Yeah.
And you see a lot of cases in the clinic where the man is infertile, maybe the sperm is not good. Yeah. I mean, it was only, I will talk about the quality of the sperm. But because they are not getting pregnant and the woman may not be able to talk about it, the family member everybody comes and then it's the woman who is not getting pregnant. So you have the male infertility and then female infertility. Okay. So when you talk about male infertility, usually it's with the semen. So you do a semen analysis to analyze how the semen is. I mean, there are times that you have the semen amount is low, so we say it's oligospermia.
Okay.
And then some don't even have semen at all. It's genetic disorder we call azoospermia.
Okay.
And then even sometimes the amount is okay, but the morphology, that's the semen looks like a toad, like a tadpole. Okay. Supposed to swim very well, the tail is shaking well, with the head nicely. So some of them have broken tails, they can't swim, so that they just go not in the yin direction. Dancing around. They are not good sperms. Okay. So all of that. So usually.
So it's not just about the count.
No.
But also
the quality.
Quality of sperm.
And then the structure of it.
Okay.
So for the man, mostly is that. So that one we just do the semen analysis and that goes on. Now, the woman's body is more complex than the man. So then when it comes to the woman, there are a lot of other things you need to consider. So you could start with, it could be ovulation. Ovulation is when the woman, in lay terms, they lays the eggs so that it can be fertilized by the semen. So if there's a problem with the ovulation, then, I mean, there's going to be infertility. And then there could also be structural problems with the womb itself, because the pregnancy occurs in the tubes, which is part of the womb. So if the tubes are blocked for various reasons, then there's going to be infertility. Now, even if the tubes are not blocked and the structure of the uterus itself is distorted by other such as fibroids. For fibroids distort the endometrium, the lining of the womb, or makes the semen and the egg cannot come together, then you are going to have problems with conceiving. So basically, I'll say that it's both a problem of the woman and a problem of the man. So we shouldn't always blame the woman when the babies are not coming. We need to investigate all of them, and then we find out. But I must say at this juncture that there are certain cases where the couple is fine, there's nothing wrong with the man, there's nothing wrong with the woman, and they are just not getting pregnant.
Because I was going to ask about the 10% you talked about, because you said 40% male factors, another 40% female factors, and a 10%.
So it can be 10 combined, and then there's another 10 you can say unexplained.
Unexplained.
Yes, so that one also exists.
Okay.
So that's when you talk about infertility, basically these are the types that we want to talk about.
Okay. When do you say a couple is having adequate sex?
Yes, so adequate sex, there's that the frequency of that sex should be at least 3 times a week, and it should be satisfactory to the couple. You know, to the couple. So there is no defined duration, or you have to do 10 rounds or 7 rounds. No. but at least 3 times a week, we'll consider that adequate, and then the couple should be satisfied with what is their own sexual activity. So once that is adequate, and for that period, the babies are not coming, then there are some basic investigations, like James mentioned, that we'll look at to see which of them is accounting for this. But after that, based on what we see, for some of them, all that is needed is just counseling. That, let's say, they are not having the sex at a good time, they are not timing coitus well, and stuff like that. And there may not be need for treatment.
When you say coitus, I'm sure my viewers are wondering what you're talking about.
That is the same as sexual activity.
Okay.
So if they are not having it at the right time, that may just be all that is needed, or the frequency is not good, that's all that may be needed. And then if we identify other causes, then we'll try to manage those things, from basic semen analysis for the man to see whether there's any of those problems James has talked about. And then for the woman, some basic investigations. Are there any pelvic masses? Are there any hormonal issues? So we'll look at all of that. Are menses coming regularly and stuff like that? Then if we identify what the cause is, then we'll tackle it. Yeah.
Dr. Boachi, I've had a couple of messages, and those who ask the questions would say that we have been married for a while. We have seen doctors. Because, of course, when they send the message, the first response will go and see a doctor. They tell you, I have seen doctors. I have been put on so many fertility medications, and yet I'm not seeing any results. What other options are available for such couples who have tried? They have gone through this first line of investigations. They don't have, let's say, the woman doesn't have fibroids. For the man, his sperm count is normal. And yet, they are still not getting pregnant.
So, thank you for your question, Vera. So, that's why you step up a bit and you go into the realms of ART. When we say ART, that's assisted reproductive technology, that's all it means. And in the ART, there are grades, the low level, and then somebody say the high tech, high level or high tech. So, sometimes all you might need is to do what you call an IUI, which is intrauterine insemination. All you do in that is that you give, you try and help the woman lay more eggs. So you stimulate the woman with low dose drug from house, exogenous hormones, so that they just lay more eggs. And then you take the semen, wash it, and then at the point that you have determined that the woman is ovulating, you just inseminate the semen. And then it works. It's not very, about 15% success rate, but it works. Sometimes
15%.
But it's good. Sometimes that is all you need to do.
And I think I should add that, I mean, when they mentioned
Because
15%, she got scared.
Yes, because 15%
in the natural cycle,
is low.
your chance about 22%.
Okay.
So
For a very fertile woman, in each month, your chance about 22% that you have a pregnancy.
Okay, then in that case, 15% isn't bad.
So once you've done an IUI, that's the basic.
Okay.
And it's assume that the tubes are normal, and the semen quality is also good when you want to do an IUI. Then you can go on and do that.
So the tubes must be normal.
The tubes must be normal. There should be no tuber blockage. And the semen quality and all of that should also be good.
If a woman has, let's say, fibroids, can it affect this procedure?
Yes and no.
Okay.
No, because it depends on where the fibers are situated.
Okay.
Whether they are blocking the ostia, that's the eyes of the tubes, if I'm allowed to say that,
or
the openings of the tubes,
Okay.
and whether they are even distorting the endometrium. That's when even
The lining
the
of the
line of the
womb.
womb. Sometimes the fibers just distort it from outside, or sometimes the fibers even located in the lining. So they cover the whole endometrium, the lining of the womb, and then, so yes, depending on where they are, they could affect this process. That's when we would advise that we take them out. You have a myomectomy to remove the fibers, and then you move on from there. So you've done an IUI. IUI is the basic one that we do. Then after IUI, then you move into what people call about the test tube, like IVF. That's in vitro fertilization. What we do in IVF is that I always tell my clients that we don't manufacture anything. We use what God has given to us. So, I mean, as I'm doing my best for you, also pray that God blesses everything, and then you get a child, because at the end of the day, it's God that blesses us children. So we stimulate the woman, and in this case, we use more drugs, sort of we call a hyperstimulation of the woman, so that we can get eggs. So we'll take
More
her
than one egg.
More than one egg. We'll take her to theater, and then there's a way to retrieve the eggs. So once we retrieve the eggs, then we get the sperm, the semen from the man, and then we put them together in the lab, and then they start growing.
Okay.
During that time, we prepared the endometrium, the lining of the womb, and everything just like the normal cycle would be. So either day 3 or day 5, depending on how they are going on, what's the preference of the doctor, you do a transfer, and then you hope that she gets pregnant. That is when the semen is also okay. In certain cases, the tubes are blocked, and the semen is also very bad. Then you have to do a higher level IVF. We call it ICSI. That's intracytoplasmic sperm injection. Okay. In that one, the difference between that one and IVF is that in IVF, when you take the eggs and put it in a dish, you put the sperm together, and then you leave the sperm to swim
And
like in a natural way, get to the egg to fertilize it.
Okay.
But in ICSI, because the sperms are not good and they can't swim, they can't do their work well, and probably there are very few, there's a special machine that takes the very good sperm and then it injects it into the egg. So it's like you aid the fertilization process. So that's ICSI. When the sperm is you have a bad oligospermia, and then maybe some of them are malformed. So you take the very good one, and then you use to insert it. And another condition where we do ICSI is that sometimes for some of the men, the semen analysis is 0. It tells you that there's nothing. But the testes, where the sperm production, you can get some there. So we do something called TESA. That we take it's a special needle where we go into the testis itself and take the sperm from there. And they use it for ICSI, because then it's just like a precious sperm. That's a good word. Precious sperm. So you don't want to waste it. So ICSI, you are sure that there's fertilization because you are injecting it directly into it. So that's basically what we have. The lower level IUI, then the IVF, and then the ICSI. So basically, that's what is available.
And Dr. Bayu, what are the success rates like for, let's say, IVF? Because that's what most people know about.
Yes.
You said for IUI, which is the insemination is 15%.
Yeah.
How is it like for IVF?
So for the IVF, it pretty much depends on the center. And before I even give figures, I should say that there are some factors that would affect it. And it's not really based on who is doing it, but there are some personal factors of the woman or even the couple or the source of what we are using, because there are situations where you, the patient, your eggs may be bad, and then we have to take a donor. So if your eggs are bad and you are not willing to take a donor, or your husband's sperm is so bad it's not willing to take a donor, and then we use it, the chance of success is low from the beginning. But granted, if everything is fine, most centers, 33% thereabout, will be okay.
A fan asked this question. I want to mention the name. Can a man with azoospermia get a woman pregnant? Viewers, if you want to know the answer to this, join us after the break. We'll be right back.
Your presence has changed my life.
Your tenderness makes me want to take care of you forever.
And I promise that I will give you nothing but the best always.
Cousin's Baby with natural ingredients also gives the best care for baby's soft skin and hair. Cousin's Baby, growing together naturally.
From your first shopping list to the very first sound you made, to your first bar, your first date. You've brought me so much joy, and I promise to always protect you. Camel Baby Antiseptic with a mild formula protects your baby's delicate skin from germs and bacteria.
Welcome back. This is Fruits of the Womb, brought to you by kind courtesy of Cousin's Baby and Camel Baby Antiseptic. Join us on Facebook. Go to Facebook, type Fruits of the Womb, and you can post your questions, comments, and contributions. We are also streaming live on Facebook. We were looking at options in infertility, and before we went on the break, we wanted to find out if a man with azoospermia can make a woman pregnant.
All right.
Our viewer seems to know a lot of scientific terms.
So
in the first place, what is azoospermia?
All right, we're trying to...
Then you answer whether a man with azoospermia can get a woman.
To avoid the big terms. So azoospermia means that the sperms are very, 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 very non-existent in the semen. Let me put it that way.
So zero.
More like it.
Zero.
Zero.
It's very generous.
More like it.
Yes.
But whether that man can get pregnant, yes.
Get a woman pregnant.
Can get a woman pregnant. If the viewer was following, yes. We are assessing that azoospermia based on what you have produced. But like James mentioned earlier, it is possible that either you have an obstruction in the pathway, that's why the count is zero, or you are not making
That's a blockage from the testis.
From the factory, which is the testis,
to the male organ.
The male organ when it is finally produced. If you have a blockage somewhere or a congenital absence of what we call the vas deferens, then when we do the analysis, it will be zero. But in actual sense, your factory may be working.
Yeah.
Okay.
So under those circumstances, we may aspirate the sperms from the factory and then use it. But if a sperm testicular biopsy has proven that you do not make sperms, then technically it is, from our point of view, it's an impossibility.
Unless a medical miracle.
Unless God does it. But from the point of view of science if we
not.
biopsy the testis and there is none, then it's virtually not possible. But don't let an azoospermia semen analysis put you off completely, because there may be a possibility that if a biopsy is taken from the testis, you may have. When
you say a biopsy, what exactly do you mean? For the benefit of
James
our viewers.
James mentioned the proper term. That's TESA. They can do it's a micro technique where we'll aspirate sperms from the testis, a small syringe.
So they stick a needle?
Yes, a small needle.
So say stick a needle.
Stick a needle will sound too scary. It's a micro-surgical technique where they use a small syringe to go in there and aspirate the sperms, and then it can still be used. So under those circumstances, yes, you can make someone.
But I guess it's not a painful procedure.
Yeah, you do it on anesthesia. You are giving local anesthesia or even general anesthesia.
So you won't feel pain.
We are not that wicked.
What options are available for a couple who, let's say the woman cannot produce eggs and the man has azoospermia, no sperm, viable sperm?
Okay.
can such a couple have a child?
Yes, they can have a child. Because Titus already has actually mentioned it. What we call the donor cycles. So if a donor cycle can either be from a donor egg or a donor sperm. So, I mean, we have clients who are about 50 years and then they want to have children. The uterus is intact. So, but obviously at 50, you're not producing eggs. And even if you're producing eggs, the quality is so bad that you might have a malformed baby if you go with it. And you might not even get a result when we stimulate you. It happens all the time. So then we get a donor egg. And the donor egg is going to be from a younger person whose eggs are fresh and then young, and then the quality is very good. So the woman, we take the eggs from the donor and give it to the woman who is the recipient. So in the same vein, if the sperm is also not good, we can get sperm from another man. So if you have an azoospermic man, as our reader asked, and then we've done a biopsy and there's no sperm, then we can get sperm from another person and then use on the egg. So sometimes this is what we usually, maybe you may have the man azoospermic and then the woman has eggs, so you get a donor sperm for the woman, or the woman cannot produce eggs, but the man is okay, so you get eggs and then use it for her. And in rare situations, you have both azoospermic man and then the woman, then you have to get a sperm donor and an egg donor and then give it to the woman, but she will carry it. So at the end of the day, technically not her DNA, but it's
but
a
then
child.
she's carrying the
carrying
baby.
it, so it's a baby.
And I think that just dovetails into what we call adoption.
Adoption, yeah.
Yes.
Because that is really the other option. But technically, in the case where you have both donors, then it is an adoption.
The child doesn't bear the DNA of either parents.
Yes, but the main difference is that the person has gone through the experience of carrying a baby and then bringing forth the baby,
bond,
the bonding and all of that. But really, another very good option for everybody is adoption.
Before we get to adoption, let's talk about surrogacy.
Okay.
What is it?
So surrogacy simply means that you are borrowing somebody's womb. Let me put it that way.
Renting.
So you are renting a womb to carry a baby for you because you are unable to carry. And so we have different types of surrogacy, and those are technical, where maybe your eggs are good, but you do not have a womb, or your womb has a problem, cannot carry a baby. We could use your egg and put it in somebody else to carry the baby for you. The person, this is a legal arrangement. So the person delivers and the baby is handed over to you. But maybe you, for whatever reason, you just don't want to carry a baby. Everything is fine, but you just don't want to carry a baby. You could still rent somebody's womb and let the person carry the baby for you. So in that case, the genetic material is yours and your husband's, but then someone else is carrying it for you.
Viewers, like you know, every week we have the question of the week. And if you get the answer right, you might win a prize from our sponsors. So for this week, the question is, send your answer to the number on the screen. Let's check out last week's winner. Congratulations. How available and accessible are these services to Ghanaians? The ICSI, the IUI, the IVF, and all the big terms,
The
surrogacy. How available are these? Dr. Boachi, you would give us that, and Dr. Bayu, you will talk about adoption.
Okay.
Well, I'm happy to say that they are all available in Ghana. And it's good programs like this to talk about, because sometimes when you meet people and you talk about it, wow, is this done in Ghana? Every one of them is available in Ghana. A little bit expensive, I mean, money-wise. But
a little.
What I mean, it depends on where you're coming from. But everybody has the opportunity to have a child. They are all available. You just have to know the right place to go, and then meet the right person, and then you can have it done. A lot of centers are now doing IVF and ICSI and all that. So
even surrogacy,
yes,
available.
Everything is available.
It's available.
Okay.
Everything is available. We go for the conference, we meet, so it's available.
Okay.
Yes.
Okay, so adoption. I just want to say that I would want to just emphasize adoption to all practitioners. We should start talking to every infertile couple right from the beginning about adoption. It's a good choice, it's a good option, and they can actually practice it right from the beginning. Sometimes you may adopt and actually later on have your own kids, and then it just adds up to a beautiful big family. So adoption, there are legal ways of going around it. You would go to the Department of Social Welfare, and then you'll be given a form to fill. A doctor will fill that for you. Typically, couples can adopt. By law, I think a adult female can also adopt, but just a single male may not be permitted by the law to adopt. Yeah, but you can, as a couple struggling with infertility, go to the Department of Social Welfare. They'll give you a form to fill. Your doctor will complete the form for you, and then you can go straight ahead and adopt a baby. And you raise that baby as your own, and you have no issue. So everybody should be encouraged to participate
in adoption, because you change the life of that baby you are adopting.
And sometimes that is the gate opener that you are just waiting for. After that, your chance open and your own may come to add, and then it just increases your family nicely.
So your final words, Dr. Boakye, about infertility.
I would like to say that infertility is not a problem of the woman, it's a couple problem. So we shouldn't send the woman to come to the doctor while the man sits in the house and quizzes the woman when she goes home.
What did the doctor say?
And then what? And then they get confused and they come back. It's a woman problem. And by God's grace, technology has advanced, and by God's grace, again, they are all available in Ghana. So let's seek help. Let's find out when the babies are not coming. The time that was already talked about, and then we can all have the beautiful experience of childbirth.
Dr. Bayo, before you give your final words, I just want to add something small on women who self-medicate, because some women hop from one fertility center to the other, and they know the drugs that they are put on. Some even take the egg-stimulating medications themselves.
Okay,
so if you can just give a word to such women.
I just want to, I would briefly say that those medications are prescription medications. They are not supposed to be sold over the counter, and it's for good reason, because there's a limit to which you can use them. Even in terms of duration, how long you can use them, there's a limit. And there are dire consequences of these medications when they go bad in terms of their side effects. For instance, some of the medication we use for stimulating you to produce egg, when it's giving a side effect, there's a life-threatening form we call ovarian hyperstimulation syndrome that can kill. So do not do this on your own. Try, get to a professional, and stay with one professional to a point where you are not happy before you move on. But just don't hop from one place to the other, repeating the same thing, because it's stepwise. So whenever you change, the other person restarts, unless it's a transfer for someone to continue. So let's be a bit patient. It takes a while and things will work out.
So viewers, this has been Fruits of the Womb, and we've looked at options in infertility. I hope that for couples out there who are trying hard to get pregnant, you've learned something from today's episode. Remember that infertility is a problem of the couple and not just the woman. There are several options available, and as we've discussed on today's show, they are all here in Ghana and they are accessible. Ask your health care provider. If you are at a center that cannot provide these services to you, request for a referral. And also remember that adoption is an option, and adoption brings a special blessing because you are changing the life of a child. Hope to see you same time next week. My name is Dr. Vera Bayo. Remember, God loves you. Stay blessed.